Bismillahirrahmanirrahim. Assalamu alaikum viewers. Hope you are doing well. Now I am here again with an amazing new topic. So basically today my topic is cancer. What is cancer? As everybody know that what is cancer, normal body cells grow, divide, die in orderly fashion. As you know that in normal condition in which body cells grow, divide and then die. Then again they grow, divide and die. But in cancer cells are different because they don't die, just continue to grow and divide disorderly. Basically, the cancer is the abnormal cell growth. Now we have what are the causes of cancer. Cell division mistake that abnormal cell growth started in body leads to cancer. Toxin from the environment that every other particles that contains the dangerous particles that contains the toxins from environment enters in your food or your daily intake, it also cause cancer. Then genes, the basic cause of cancer is nowadays a genes that we are attaining cancer from our forefathers. Then we have types of cancer. So first we have carcinoma. Carcinoma is the cancer in the skin or tissues surface, only on the surface. The first and the not most dangerous type of cancer. For example, lung cancer or breast cancer, not in the depth. I repeat, not in the depth. Then we have sarcoma. Sarcoma begins in the bones and the soft connective tissues like bone cancer, which also not a most dangerous type. Then we have melanoma, most serious skin cancer by melanocytes, and in our skin there is a melanin, the pigment which causes the color of our skin. So in melanoma, the melanocytes decreased by their number, so it leads to the cancer basically. So we have next one is lymphoma. Lymphoma is the cancer begins in the lymphatic system. Then we have leukemia. Leukemia is basically the most dangerous type of cancer, and it is basically the blood cancer, the cancer that present in our blood cells. Then we have risk factors, that what are the risk factors basically which cause the cancer. Basically less than 25% of the cancer spread through genetics and biological functions, but most of the people develop by diet and smoke. Smoke is the highest cause of the death due to cancer. So what we have is now that what is carcinogen. Carcinogen is basically a cancer causing agent, that tobacco, ultraviolet light or an environmental poisons, that all are basically the type of carcinogens which cause cancer in human body. Then we have use of tobacco, that how tobacco cause cancer. So basically tobacco highest cause of cancer. Harmful carcinogens, it contains harmful carcinogens which cause the death due to cancer, frequently used in youngsters, mostly youngsters, and ultimately cause death. Then we have diet, variety of dairy foods, food we eat in our daily life and how it prepared cause death or cancer. Basically cancer and death, they both are reciprocates. Then we have alcohol. So when we take excessively or consumption of alcohol in our daily life, it causes also cancer because it damage our respiratory system. And when a woman take the high level of or high consumption of alcohol, it may leads to the breast cancer as well because it damage our liver. Then we have environmental risks. we have toxic chemicals that are present in our circumstances, which we inhale through our breathing, which also caused maybe lead to the cancer. Then radiations, the ultraviolet radiations or all other radiations that come from our sun, which may cause tanning and sunburn, which also leads to the skin cancer. Then we have stress. So researchers are trying to research that stress also leads to the psychoneuroimmunology. Okay, basically it leads to the cancer as well, brain cancer. Then we have treatments. So basically, there are many types of treatments like radiation, surgeries, biological therapies, chemical agents that we enter in the body to treat the cancer. So first of all, we have early diagnosis. If a person is having any cancer and he or she diagnosed at the early stage, then there is a normal treatment for like a medication or therapies which they cope from the cancer. Then we have treatmental option, that we have option that we take surgery, chemotherapy, radiation therapy and combination of regimens, etc., or maybe bone marrow transplantation. Then we have surgery. That what is a surgery? It is basically the oldest way or oldest treatment of the cancer, in which we basically replace one damaged part of the body with the new or healthier one. In this surgery, if we have any cancer of blood cancer or we have any skin cancer, then we replace that damaged part with the healthier one. Then we have chemotherapy. Then basically the chemotherapy is the process, it is basically the medicines to treat the cancer, while radiation therapy and the surgery destroy or damage cancer cells in the particular area. The doctors basically use the radiations or ultraviolet radiations to remove dead cancerous cells in the body. Then we have cancer and psychology. So basically cancer and psychology, they both are related. Then because when a person is having a cancer, he may face anxiety, heartbreak or depression or many other things, like he or she feels that why this happens to me, or maybe it caused death and they don't have any choice, so they are facing anxiety or depression, which leads to their heartbreak. Then here we have the Kubler-Ross model. He gives the 5 stages that person, if a person is having a cancer or any other dangerous disease, then he or she pass from these 5 stages. Then first we have denial, that person is trying to shut out the reality or magnitude of his or her situation and begins to develop a false preferable reality that he or she may not facing this problem. Then anger. Once in the second stage, the individual recognizes that the denial cannot continue because of anger. The person is very difficult to care for due to the misplaced feeling of rage and envy. The person can be angry with himself or with others as well, that the person is questioning, then why me, it's not fair, why would god let this happen, that why happen only happening with me. Then bargaining, the third stage, which cause that the patient can become lost in a maze, that if and only statement is this bargaining, that why only me. Then we have depression. Then the fourth stage is depression, that the person who is having a cancer or any other dangerous disease face depression. Then acceptance, that at the last the person accept that yes, he or she is facing this problem and he or she have to face it. Then what health psychologist role play in the coping with cancer. First, social comparison, that if a person is facing any problem, according to social comparison, that others don't have any cancer, but why I? Then social psychologists must take their therapies or their other like therapies that to help them to cope that. Then emotional disclosure, that persons become heartbroken, they facing anxiety, so social psychologists must help them to avoid this. Then the other systematic interventions, that like face to face support, group meetings, these are the other systematic interventions to cope with stress and anxiety immediately after their treatment. So preventions in cancer, there are three: primary prevention, secondary, and tertiary. So basically, primary is the direct avoidance, reduction in exposure. For example, exercise, tobacco, nutrition supplements that he or she may take to avoid that cancer. Basically, vaccination as well. That the first step you are taking for the cope of cancer. Then the secondary, the second step, in which early detection, the treatment, and then for the coping, removal of that problem, or removal of that ungrowth cells, abnormal growth cell. And the third one, the last one, is tertiary. The tertiary prevention can be initiated after diagnosis. Then after diagnosis of cancer, improve quality of life and survival for the person. So thank you so much. Allah Hafiz.